Well, now the Tamil Nadu government has imposed a 2-week complete lockdown in the state. This, of course, in lieu of the rising COVID-19 cases. Sam Daniel joins us with the very latest. Sam, what more can you tell us? What's going to be open? What's going to be shut over the course of the next 2 weeks?
Rishika, we come to you from the Lust corner in Mylapore, and if my camera person can pan, this is what you see. All the shops are completely shut and police have also erected barricades, except shops selling food, medicine, vegetable, fruits, milk. All other shops would remain shut, and even these shops ought to shut down by 12 o'clock. No liquor shops. Restaurants cannot have dining. They can have only takeaways at designated hours. And home delivery by Swiggy, Dunzo or Zomato and these platforms is available. And at the moment, even vaccination drive, people can show their bookings and go ahead for vaccination. And in Chennai alone, police say they will deploy around 10,000 police personnel to ensure that the lockdown is implemented. Chief Minister M.K. Stalin has designated 22 ministers in 14 hotspot districts to ensure the lockdown is implemented totally. And I have with me Dr. DDPR David Prasad from the Apollo Hospitals, who has been treating COVID patients for a long time. Doctor, how will this kind of a total lockdown in Tamil Nadu help?
Well, what we are now witnessing, I don't think so, it's just going to be a second coronary wave. I hope it's not a tsunami. So what we are trying to do is we are understanding that the cases are increasing so very rapidly. Currently, all hospital ICU beds and oxygen beds are being occupied, and therefore we do not have the infrastructure to deal with an additional load. I know we can scale up and increase the number of ventilators, just maybe in a day make up makeshift hospitals. We are importing a lot of oxygen tanks from UK and France, and industries are pitching in to increase oxygen. But the real question is, do we have the manpower to tackle it?
What is the situation in government hospitals? We know there are no beds, but how do you really tackle this?
Well, I think they're scaling up massive time, and they're redeploying people who are working in other areas to also come and take care of critically ill patients. But I think that will help only in treating the mild and the moderate cases. But when you have the severe cases, you need to have people who are experienced in treating those critically ill patients, ventilated ill patients, both doctors and nurses, who are currently overstretched with the number. They may not be able to give the important time that we need to give for each patient to make the critical decisions. So we need to have a lockdown to break it. To put it better, I think we are in Chennai, we are having breakfast. Breakfast time, I think idli is a favorite breakfast. I think you and I would love to have idlis. 5 idlis over 15 minutes, I think we will relish. But if you are asked to eat the same 5 idlis in 1 minute, I think it's impossible. We get suffocated. So that's
Thank you very much, Doctor, for your time. And it's the first challenge for the new government. Rishika, already Chief Minister M.K. Stalin has announced 2,000 rupee relief for the poor people, hoping that will give them some kind of relief. But he has said it's going to affect the common man very hard, but this is the only way to break the chain.